Shocking numbers. More women in the U.S. die due to pregnancy-related causes than in any other developed nation. Last year, the Biden administration came up with a plan to deal with this problem, laying out a strategy to address why women are dying, the lack of care for some women, and the postpartum experience.
Those numbers are alarming. And joining us now is the Secretary of the U.S. Department of Health and Human Services, Xavier Becerra. Good to see you, Mr. Secretary, and thanks for being back on with us.
Thanks for having me again.
All right, so give us an idea of the challenges that our country faces when it comes to maternal health.
Well, probably, DeMarco, the greatest challenge that too many women face is just access to the basic care that they need. Basic supplies once they have their baby, basic information on how they can not only maintain the health of their baby, but their own health as well. And one of the things that ends up happening is we see in America, the richest country in the world, more women dying, more babies dying than in other comparable countries that have this developed an economy. So it's a very difficult situation, and it's worse, of course, in some of our communities of color, like the black community, our indigenous community, and we're out there to try to change that.
Now, when we have this kind of health care, you just expect everyone would be okay. You've partnered with the nonprofit organization Baby to Baby on a new pilot program. Explain to us what's going on here.
Yeah, first I got to say big thanks to Baby to Baby. It's a nonprofit. They already do work trying to reach new moms and their babies, but now they're partnering with us. We're doing something very basic, helping new mothers get the basic supplies that they need. Don't worry about the cost. Half of American women who have babies sometimes worry if they even have the money to pay for diapers. And so just getting rid of that stress of knowing that you've got the initial supply that you need could be very important. Baby to Baby is making it possible for us to reach women who are right now in need of that help.
And Secretary, this hits home for me as a board-certified OBGYN. These supply kits are a great first step, part of the blueprint, but what else is the administration doing to address this really concerning maternal mortality epidemic?
Dr. Ashton, my wife too, is an OBGYN, and she's worked hard on these issues. One of the first things that we need to do is really make sure women have the total care that they need, not just the 1 month supply of diapers and clothes for your baby, but what about your mental health? Do you have access to mental health care professionals? Do you have access to constant follow-up checkups for your baby and yourself? What we have done in the Biden-Harris administration is make sure that women, especially those women on Medicaid, are able to access care not just for the first 60 days after they deliver, but now under the president's Medicaid proposal for those women in Medicaid, for 365 days they'll have access to the care that they need for themselves and for their babies. That's tremendous. So far, 35 states have taken up our challenge and accepted. That still means 15 states have to join on board to make sure their new mothers and those babies get the care they need for a full year.
And you mentioned not unplugging from the mom after delivery, that so-called fourth trimester, so important, but you also mentioned mental health. Psychiatric illness, one of the leading causes of maternal mortality in this country. What else are you doing to address mental health for moms, both during pregnancy and after?
We're actually focusing some of our resources to help grow the pipeline of health professionals who are in maternal health, but also can deal with mental health because we have such a shortage of mental health professionals. We started up a maternal mental health hotline so women can get the information they need. They can call the number. I think you're going to post it, but it's 833-TLC-MAMA. If you call that number, you're not sure where to go, you think you need help, even basic questions, please feel free to call that toll-free number. We want to be there to help you, and so whether it's your mental health or your physical health or that of your baby, you should have access to that when you need it.
Secretary Becerra, thank you so much for being here with us today. And as he mentioned, if you need help, you can call or text the National Maternal Mental Health Hotline at 1-833-TLC-MAMA. That's 1-833-852-6262. But it is truly alarming that there's not an OBGYN in every county in America to take care of women that need the help.
That's right. And in the UK, the male spouse of a pregnant woman has a greater chance of dying during pregnancy than the woman. So just close to us in the UK, they're doing so much better than we are.
All right.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here. To get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.